Okay, good morning, folks. Happy Friday. It's going to be a rainy weekend again. I don't know what's up with that. The sun shines during the week when we have to work and it rains on the weekend, but, so this morning we're going to do two things. We are going to hear from the reports of, folks who have reviewed the committee reports due to our committee. And what was the one yesterday that, right, we need to get that report.
I got it. I have the link. I was looking at it.
Oh, you do have it. Okay, so we did receive the report. Okay, was it on our
I
webpage?
remember here.
It's not on our webpage.
Was it because it came in last year? Okay, it's just one that
Yeah, because we were talking about it.
we were talking about it someplace. Because I think that it was, we had asked them to, look into that. So, okay. So, let us, move to whoever wants to go first. Okay, yes, go ahead, Eric.
I'll be quick.
Okay.
Yes,
Tell us which reports you reviewed.
two, but they coincide in accordance with Act 163, one being the Recovery Residence Certification Report, and the second one being the Recovery Residence Exit Data. And both reports is provided in accordance to Act 163, which was an act relating to systemic. Is that even a word?
Systemic.
It's
systemic.
See, there's no R's in there. That's what the
Put one in there, systemic or whatever, you know.
evaluation of recovery and recovery communities. This act directed the Department of Health in consultation with other state agencies and community partners to develop and recommend a certification program for recovery residencies operating in a state that choose to obtain certification. Report goes on for a couple of things. There's no universal definition of recovery residencies, nor federal regulations or certification requirements universally established. There are many models of recovery housing, and states vary in their regulations. The National Alliance of Recovery Residencies, NARR, provides standards and frameworks for levels of support. The NARA has affiliates in 30 states. The Vermont Alliance of Recovery Residents, VTAR, is the Vermont's affiliates to NRs. The many stakeholders participated in the meetings. The report outlined them looking at different models from other states, barriers to available recovery housing beds, suggestions to establish their own certification process, eligibility requirements, data collection. They also looked at the SAMHSA practices, service delivery policies and procedures, discharge and governance, and discharge and grievance policies, and the applicability of the landlord-tenant law. The department also provided draft legislation suggestions within the report. The majority of the report, pretty much the last 17 pages, was feedback from stakeholders and others that participated in the meeting. My suggestion to this committee is that we take testimony from the community partners as well as the Department of Health, because they are in the process and we are going to be responsible for getting those certifications into place, as well as looking at the landlord tenant laws in relation to recovery residencies and the certification process. So I think it'd be important to bring some of these agencies and partners on in to hear and get their feedback to where the process is at and how we can go about supporting and making sure these things get implemented into statute.
Okay, so this, as Eric said, was a follow-up and required reporting from a bill that we passed last year. And it is going to require further legislative action. So this is kind of, again, we're in the process of teeing up stuff for next year. And I think it makes sense for us, and Lori's already working on getting folks next week to testify on this and to sort of further review the more specific recommendations that the department's making. And they did host focus
Yes.
participation from a whole host of individuals and organizations that they invited. Most of them participated. And so I think that it's, I have to say, very helpful to be going through these reports. One, it reminds us of things that is unfinished business from our previous session. And two, it helps us to think about how our work is going to be prioritized for next year. So any questions for Eric about that? Okay, so we are going to invite some providers as well as the Department of Health in to give us some testimony about these reports, but also to sort of tee up what they would be expecting us to do next year. Because some of this stuff requires legislation, others of it does not. But so, okay, all right.
Just quickly to follow up on the second report, which was just the recovery residencies exit data. The data presented was between 7/1 of 24 to 12/31 of 24. It's relevant. It has relevancy, and what it's just sharing is, how people were removed and maybe what was the reasoning behind it, whether it was return to substance use or whether there's violent or threatening behavior, whether there was a safety plan that was used to help expedite or work with that individual to maybe go to another location safely. Unfortunately, it really doesn't have a big sample to really produce a strong outcome. Again, it was only based upon a 4-month thing. Still relevant, but I think that's also going to be effective when we speak to some of these agencies in regards, because they may be able to share where some of their challenges have been, as well as where some of their strengths have been, and barriers that may need to be addressed to help expedite these things in a more proactive manner. But so yeah, that's 2 reports.
So on this one, just some background. These are both as a result of the same act, but there was concern in our committee and maybe downstairs in House General. I can't remember. I know that they took a look at the bill, but there was some concern about, the use or it's a temporary, it's not a permanent, but it's a temporary suspension of the landlord tenant laws as it relates to recovery residences. And we heard a lot of testimony in committee about pros and cons of doing that. And so one of the things that we wanted to, and we heard in testimony that the residences had, the people who had testified at least had backup plans, and the people needed a safe exit plan if there were to be an exit. So it's a sampling. It's not everybody, obviously, but you can see in the report there were 1, 2, 3, 4, 5 organizations reporting. And in total, there was, a number of removals. However, nobody was exited to homelessness, which was the concern of our committee when we did that. So they were provided with temporary shelter and a safety plan. So I think that's important. It was important information that was part of our concern. And so we'll appreciate talking more about that, because this data will help inform whether or not we make that exemption permanent or not. So great. Thank you, Eric. Appreciate that. Any other questions for Eric? And I know I gave him, special kudos because he got this assignment when he wasn't here, and he followed up all on his own. So I know he's the overachiever in the group, but it's okay, Yeah, you get a star. Okay, we may have put up a few more stars. I don't know if anybody noticed. Did you? I wondered. I was like, Lori will notice. Okay, thank you. Go ahead, Doug.
Just one question.
Yeah, sure. And then we'll go with the follow-up. Go ahead.
I'm just curious, looking at the table on the last page of that report, the exit data, looking at something like this for the first time, does anything strike you with respect to the number of exits of being in the range of what we might expect, higher, lower? I imagine that people in recovery, it's challenging. It doesn't always stick the first time, et cetera. Just didn't know if you had any thoughts as you looked at those numbers.
Actually, what's interesting with the exit is I think it needs to be deciphered a little bit better. Reason I say that is because, well, there's the Good Samaritan Haven had 10 exits. Were those exits a result of a return to substance use, a result to violent or threatening behavior, or a result to successfully meeting all their obligations, requirements, and commitments as outlined and have transitioned into their own independent living place?
Well, it says the reason for removal was substance use for 8 and violent or threatening behavior for 2 of them.
Yeah, but underneath where it, right here on the removal status, exit removable. And then it goes down and exited removal, an individual from these things, the option to return to the residency is on a case by case basis.
Right.
That it can correlate, but I think some of those could be reflective of moving on to a independent location and not necessarily were exited based upon maybe negatives. There could have been some other positives. I don't think that.
Well, we don't, and they didn't, honestly, it didn't ask. Well, removal is something, I guess, I don't know, I might challenge that a little bit, Eric, because removal is saying that you are being removed by the home, not that you're leaving voluntarily.
Yeah, I could see that from the temporary part, but I look at like exit removal. That can be, it can.
Yeah,
I'd probably say we're aligned with your interpretation that the exits were based upon reasoning in the next column. But I would like to see some clarification in regards to that, because
Yeah.
it also shows you're going to have those numbers. But then you also want to be able to share the also the positives that and reasons why that
Yeah.
the better move on.
yeah. And that might be something that we ask for in terms of future data collection, when somebody left the residence. So these are only people who left the residence because they were removed by the provider. But I know that, there are people who leave the residences on their own, and maybe returning to permanent housing or,
Yeah.
whatever. So it's good. And it's important to know that these are organizations. It's important to look at the number of beds over on the right-hand column if you're looking at the report. So while Vermont Foundation is 13, they have 66 beds, okay, that are a member of that Vermont Foundation, okay? So,
Yeah, right. And so, yeah, when you look at this data, sure, there would be something that when we looked at it that would be, and why I would like to hear more in regards to a little bit of a reasoning, because if we look at Good Samaritan Haven, within that time frame of 4 months, exit removal 10, number of beds 13.
I would want to ask more questions about that.
Yeah, so I don't think it's fair or appropriate to assume what it may have been and to maybe look at there's got to be something
Yeah,
in that, and also acknowledge these things are not a reflection of the operation of the agency.
Well, and I guess it could be, is it a question of program efficacy, or is it a question of the standards that they use for removal? One program may be stricter than the next, so it has a higher rate, or is there?
yeah, well, and it makes a difference on what level of, like, I don't know the answer to this question, but if all of these programs listed here, are they already certified residences?
I can't answer that. I don't know I don't.
So if they are, Doug, there's particular protocols, they're all supposed to have the same protocols, right? So, all right,
That's what
well,
we're moving
more
towards,
information, that's what we're
right?
moving
Yeah,
towards.
to have
is
more
to have more
alignment.
certified, yeah. There's a whole host of ones out there that are not certified, and so we're looking towards having some more uniform expectations for people who enter these sober houses, to be able to, understand, you know, what the kind of rules of the game are. And
Have them be consistent.
have
across
them
the
be some,
state.
have some consistency, especially because we are now supporting these homes with state dollars.
Right.
Not all of them, some of the other ones are not supported with state dollars, but. Okay, so that's, any other questions for Eric? Come on, let's see if you can stump him. So far, we haven't been too successful, so.
Follow up?
You think it was one question, but in two parts?
One question and 27.
All right. Okay, great. Thank you, Eric.
Thank you.
Appreciate it. Okay, who wants to go next?
I would love to go because it's very quick and I have good,
Oh, let her go. Good coverage? Okay, go for it, Ann.
am I on?
Yes.
Okay, great. Yeah, because mine is pretty quick and I have good internet right now. So my second report, I reported on one last week, but the second one was the Health Equity Commission. And that was primarily the Health Committee, which established the committee. The legislation was, I think, 4 years ago. But it also looks at issues of social determinants of health and statewide health issues like the Department of Health. So it is partially our jurisdiction as well. And they have an annual reporting requirement. They had several recommendations that they had been asked to report. They had been temporarily initially housed under the Office of Racial Equity for staff support. We knew that was temporary. It wasn't clear where the best location would end up being and who could take it on. And they did reach consensus to recommend that it be under the Department of Health and that the Office of Health Equity be established, also be under the Department of.
Oops.
We're losing you, Ann.
Okay, I'll try later.
Okay.
All right, I thought it was good for now, but
We can hear.
Oh, it's good right now, so keep going.
Okay, all right. So, so at first, my first reaction was, well, I haven't seen any bill. I hope the Health Committee saw this. And then when I was reviewing the appropriations bill, all of those changes and putting things in place are in the appropriations bill as now passed the Senate. The one other major recommendation they had in this year's report was that knowing that there were health reform initiatives being discussed and not final yet, they wanted to emphasize that health equity be a priority that's, front and center in any health reform effort. And the major reform bill that came out of the Senate did not have any reference to that. I touched base with the Healthcare Committee and some of their members now in terms of the bill purpose and pieces like that to make sure that that remains on the primary agenda whenever we're talking about progress in quality healthcare. So, so it's all being addressed well. I think one other thing was asking to consider making it the report every other year. It is their relatively new commission. The only other recommendation.
And do you think that they should be every other year? It seems like it's under the jurisdiction of the Health Committee, so we'll let them decide that.
Yeah, that's what I think. I think their reasons for it, made some sense, but I think that is Health Committee to look at.
Okay, and I did notice that Green Mountain Self Advocates was an appointed member, but they have not selected an appointee. So we might want to reach out to them and ask if there's anything we can do to assist them with ensuring that people with developmental disabilities are represented on the group.
That's a good idea. Yes, I also noticed that. Yep.
Okay, thanks, Ann. So that doesn't require right now any further follow-up from us. That's what I'm understanding.
Correct.
Okay. Anybody have any questions for Ann? Yeah, go ahead, Eric.
Was H293, that's when we're now we've put it on the committee and the bill got passed that allows them to come back now every 3 years with this report, correct?
Did it say every 3 years?
Well, you're talking about the Health Equity Commission?
Yeah.
No, it's currently every year. It's currently an annual report. And they were suggesting that they be every other year, timed in terms of recommendations, but giving them 2 years to work on issues, and then bringing back recommendations at the start of each new legislative biennium.
Okay.
Was your question was the bill that,
Yeah, we addressed.
That we-
H 293, which, health equity data reporting and registry disclosure requirements.
I know, why am I drawing a blank
Yeah,
on
none
that?
of us are remembering that.
It was ours.
Yeah.
Oh, okay. I think that may have been, we did have one that was specific to addressing disparities in the juvenile correctional, the juvenile justice area because of the disparities. And we wanted to know what's the plan going to be to avoid a repeat of
All right, I'm so weird how you forget me so
Yeah,
quickly.
that's a different.
Yeah, okay, so we have passed out, thank you, Eric. I'm glad somebody on our committee is, on top of it. Like,
Again.
another star for Eric, okay.
It's Eric Day.
H 293 says every 3 years, beginning in 2028, they would be, but I'm not sure that's for this Health Equity Commission, Eric. I think that's for the, well, it is equity data. That's about, so it may be covered, Ann. Their recommendation may be covered in our bill, H 293. That moves something I'm not sure it's the exact same thing, but to every 3 years as opposed to every year. So,
okay.
and it's in, well, that's because it didn't meet crossover, so it'll sit in rules until next year, probably in the Senate, so. Okay, Eric gets another star for today. I don't know.
Yeah.
Okay. Okay, Brenda, you're next.
Okay,
So shut down.
I had the cosmetic, so. Vermont
Bless you.
legislature
me.
letting cosmetics projects 2025 report to legislator in accordance with Act 131, Section 12, Act 31 relating to regulating consumer products containing, and I can't pronounce it,
Hey, that's all right, we know.
and something substances and other chemicals. Act 131 and was 2024 requires the department to observe and evaluate Washington's experience of implementing a 1 part per million limit on the presence of lead in cosmetic products. Attached to the report is also a 5-page policy statement. So the report is 10 pages, but actually 5 pages of the actual report. This report on lead in cosmetic products gives an overview of the 2023 legislation that was passed in Washington and is submitted by our committee by Dr. Mark Levine, Commissioner. And that was an overview. Manufacturers of cosmetic products sold in Washington that choose to use this interim policy must notify Ecology through an online submission form of their decision to meet the conditions of the policy and provide contact information. So on page 5 is the documentation from the manufacturers that have signed on and the manufacturers that have not signed on. Ecology learned that the strict limit is very difficult for manufacturers to meet, if not impossible. To achieve this in some of their products, Ecology made a determination not to enforce the strict compliance with the 1 ppm limit on the lead with respect to a cosmetic product. Manufacturers are required to provide cosmetics at the lowest level possible. So I believe the report did meet the requirements as requested during that process, and that's my report.
So the purpose of us having them looking at Washington before we this is, when the PFAS bill, we did our PFAS bill last year. We were talking about the amount of lead in cosmetics because it naturally occurs in the environment. And so there are natural products like soils, like clay, that already contain lead. It's not added to a product. But what are the processes that could be used to remove the lead from the product? So it looks like in Washington's case, is this accurate, Brenda, that they have, it doesn't look like they have implemented the strict 0.1 parts per million, but they
It's
have,
almost impossible for them to.
it sounds like
Face
they've
masks.
they have agreed to something less than the 10 parts per million. That is federal, but
1 part per million.
right, less than what the Washington law currently states. That's the way I read it.
Me too.
Is that, yeah. So at one point we were looking at whether we would do something that was the same as Washington, and I guess the tagline on this is that Washington itself has not been able to implement what it is that they passed. So it would not make sense for us at this point in time to pursue that low of a option. Now, whether we can pursue something that is greater than that, which is what Washington looks like it has been able to implement, but less than what the feds currently allow, which is the 10 parts per million, will be an option that we talk about. Did they give any recommendations as to what they think Vermont should do, Brenda?
I didn't see that.
Okay,
I didn't see even the word Vermont in it. Unless I missed it. I've read it like 3 times. I didn't see anything about Vermont.
yeah, well, we had asked them to analyze what Washington did. as a-
Right.
Yeah, I think, I mean, we had a really robust debate on the House floor because some members really felt we should be doing, but not of our committee. Our committee took a position to not do it, and there was a big push.
Yes,
Taylor and
And
I both voted.
yes, for it.
Yes,
Yeah.
right, the committee
Unanimous.
was not, it was not unanimous in the committee, but the committee did take a position. And then it was very much debated, but our, compromise, if you will, if you want to call it that, was to say, well, let's see how Washington does and make a decision about whether to change, what we passed last year. So,
Good call. Yeah, it was.
Which appears to be borne out, sometimes we make a right call and sometimes we don't. So, I think this is information for people who may want to pursue this, next year, that, it looks like we could achieve something that is less than what is currently allowed, but it would have to be more than what Washington has in current statute, because they have not been able to achieve that. So it's kind of like taking steps forward, but
Making progress.
not giant step, but maybe a medium-sized step. So, okay, so that's for anybody listening about this right now. If people have an interest in pursuing that in next year's PFAS bill or chemical bill, which we seem to have one every year these days. So that's something that probably would, now that we have more data, would be helpful. So any questions for Brenda? Okay, all right. Thanks, Brenda. Who wants to go next?
Yes, I will.
Okay, thanks, Todd. Which ones did you have?
Adult Protective Services,
Okay.
okay? The annual report, I read it like 3 times. It looks fine to me. And I'm not really prepared to answer questions.
Well, you have to. I'm sorry. That's.
Give it a shot then.
I don't have a question just yet, but somebody else might do. So they have certain requirements, is that right, that they have to report?
Yes.
And so what was, is there anything that stood out to you that we should be thinking about, concerned about?
It looked fine. I read it 3 times. It looked fine to me.
So were there any, is there any discussion? Because this is the first annual report since we modified the law. And was there any, discussion in the report about that?
I can tell you right now.
Okay,
I will say on page 6, they had to provide updates on timeliness and responding to reports. And it says they were developing this new information management system that hadn't been deployed yet. And so it wasn't available yet for SF, for that time period. And then it says they anticipate having access to this data by May 1st right now. So it may be worth a follow-up to look at that data. Now that it may not exactly be, but should be available soon.
right. So, since, Dan and Todd are our, Dale contacts, maybe you can follow up with ABS to see if the data that's, about, that they were not able to provide because of the new data system, if that's available yet, since we gave them an extra day. It's now May 2nd.
Do that.
That'd be great. Thanks, Dan. Any other questions for Todd? Pardon me?
An email from Rebecca came last week saying it's gonna be, or
Oh.
on Monday.
Monday. Oh, okay, so forget that.
Next week, we should have
I
access
remember
to the data to share.
Okay.
Oh, yeah, I see there's a few other where
I saw it.
yeah.
Yeah, it's more than just that one.
Yeah, and
I'm
I just.
Scrolling through.
Me too.
Yeah.
Go look. Yeah.
Okay, so they'll have updated data next week, so they already answered our question. Okay. Any other questions about that? All right. Thank you very much. Who's next? Have we gone to everybody? Tom did his.
I have 2, but.
Oh, you have 2, okay.
I don't, go ahead. I'll defer to others for a while.
I have 3, so we could go like back and forth.
Okay.
So let's start the bench for a while. How about that?
I'm just, whomever.
Which one?
I'm happy to go for me.
Sure, go ahead. Yeah.
Okay. So I have the Vermont Deaf Hard of Hearing and Deafblind Advisory Boards.
That's very relevant.
And after reading this, there's a lot to do with education. And there's also a lot of really unanswered questions here that maybe we might have someone as a witness come in and talk about this report. And I'll tell you what I mean by that. So just quickly, the mission is to improve the lives of Vermonters who are deaf, hard of hearing, and deafblind by recommending policy and promote diversity, equity, and awareness and access. So one of the things that this commission, I've got to find my right page here. And this leads into their recommendations, but one of the things that is in there legislatively mandated is to assess the services, resources, and opportunities available to children in the state who are deaf, hard of hearing, or deafblind, including appropriate data collection and reporting requirements concerning students with disabilities. So in their recommendations, they have a few, and I think the one that stands out is the first one, and it requires mandate AOE to share the entire year-end report to the council in a timely, HIPAA-compliant manner 1 month following the grant closure without having to go through a public records request. I don't know why they would have to go through a public records request, but that is right there, number 1. Maybe this is something that the education committee might look at, but And where I think this really resonates is, just find some data here. In their 23 data that they were able to access, they found, bear with me a second. They found that 42% and 42% in reading and writing and 44% in math were 2 years or more behind. 21% in reading and writing and 22% in math were more than 3 years delayed. Together, nearly 50% of the students were 2 or more years behind academically. So maybe they should have some data go into this committee on a regular basis. If those are the outcomes that we're seeing in our education for these individuals. So it goes on to the report requests that they require an appropriate state agency to review the federal reporting requirements and data reporting system at the AOE to rectify the data disparities. Anyways, I just think it might be interesting to hear from this commission. Spencer Wepler is the chair.
And maybe this would be something that we would have,
Would be with education, because it's a lot
Education,
around
right.
education. And this, you can look at their legislative requests. They look for a Bill of Rights. And that was a bill that was in the Senate, passed the Senate, but wasn't taken up in the House last year. Obviously, the biennium ended, so it didn't get taken up again that I know of.
well, one of the things that I'm wondering about is, like you said, maybe a joint meeting with our education committee,
Mhm.
or maybe, I know this report went to them as well, I believe. Yeah. Maybe we should be talking with them about that, and it probably would not, I mean, it sort of coincides with, the testimony we're gonna have this afternoon from around bill we have on the wall, but about people who are deafblind on the adult side, but we haven't focused
Right.
on the identification and assistance of kids in the education system, as well as one of the things I'm noting that they made from a previous recommendation. And this would be maybe hooking up with our commerce and economic development, because they deal with workforce issues, is, what can we do to increase the number of interpreters in Vermont? Because there's a real lack of interpretation services in
Yeah.
Vermont for people who need them. And we have had zero focus on it, and neither have they, but I think it's only because it's not an issue that's been brought to their attention. I'm thinking that maybe some of the specific recommendations that they have, if we do, maybe we do some cutting and pastes of the recommendations and forwarding, and then, like, I'm pretty sure Chair Marcotte would try to do something about that if we could figure out a way to assist. I just think that they aren't aware of that issue. And
Yeah, and it's kind of hard for a commission like this to be able to make reports to the legislature if they don't have access to the data. I mean, it goes on to write, since 2021, data has not been readily or consistently reported to the council, nor easily accessible from the AOE. Current data collection system at the OAE is likely underreporting the number of students who have primary disability.
yeah,
What page are you reading from at that point?
So this is on page 7, the very top. Right above their recommendations, which are on page 7. So anyways, I think this warrants some possibly more testimony, whether it's through the education committee, if we just even have that discussion with them, or maybe it's a joint connection with us. I know they're going to be busy in the last days of the session here, but
well, they might have time next week, to be honest, because the Senate they didn't vote anything out yesterday, so
Just a thought,
Yeah.
even if it's half hour,
Yeah.
just to have the commission run through these, what they're seeing and really be able to ask them some more questions. And
And this
maybe
is
even
something
someone
that-
from AOE to come in and talk about what their thoughts are on the commission meeting.
Well, and I see this is actually something for us to learn from. So we're about to vote on a bill about the Rare Disease Advisory
Yeah.
Council.
Yeah.
Okay, this is an advisory council. It's kind of, it exists outside of state government, really, but it's meant to advise us on issues. And really, these things are set up where there is low incidence. Okay, so there's a low incidence of individuals who are deafblind. I think that they are saying in here, and from what I have glanced through, that they believe that there's an undercounting of an under awareness at the in local schools and at the Agency of Education about children who might be impacted by lack of hearing. And and that obviously can impact their entire learning. And it's amazing what humans do to compensate, and you don't even realize that it's happening. So let me check in with Chair Conlon about whether or not they'd be interested in a joint hearing. And at the very least, I think we should call to their attention this, and we can hear from the committee.
Because I'm glad that you assigned these reports, because this would have fallen through the crack, just like these kids.
Yeah,
Just like these kids have.
yeah,
I mean, if you didn't say, Dan, read this report and report,
yeah,
we wouldn't be having this discussion.
yeah,
This thing would be on our page. So
yeah.
thank you.
You're welcome.
Madam Chair, to that point of falling between the cracks, I fear that that's likelihood of that is increased when we have 7 committees that receive the report. Is there ever an assignment? I mean, I understand, and we've just passed S36 where there's few committees receiving copies of reports. But in situations when reports are issued, is there ever a designation as a primary committee, if you will?
Well, there's always these jurisdictional
Yeah.
dilemmas, I guess you would say. So, and whenever we have something come back to the House, it always has to come back to the House and the Senate. So there's always automatically 2 at a minimum. And then if they're, in this case, like, I'm not really sure they needed to go to healthcare in this case. I mean, I think that they could have implications, but I think the Health Equity Committee actually more likely to deal with equity issues around disability than this committee would be. But certainly in education and adult services, that, so the answer is no, I haven't ever seen that.
Yeah.
I
But
think something I'd like us as a body to move forward towards, which I had a bill and got lost that I don't know what's happening to, but our committee's doing a really good job of this oversight and accountability this year. We Madam Chair, you prioritized it, and we've been really intentional about looking at this. And I would love to see some consistency across the building in each committee of maybe utilizing some of the systems that we've built here, what we've done as a model, because like Dan said, a lot of most committees don't have the capacity. And honestly, in my time here, this is the first time we've had the capacity to actually, and I've really appreciated that we haven't been slammed at the end of the session, really pressured for time. So it's been really nice to be able to be thoughtful, look back and think about what comes to us, and thinking about being thoughtful about future legislation instead of just randomly being thoughtful and tying it to things that are really needed and expressed and studied, which, we're famous for doing lots of study and
Requesting them, right?
groups,
Yeah.
but we should take action and prioritize those actions given the landscape of the session. So I'm hoping that leadership will kind of use us as an example to.
well, they did actually the last couple of chairs meetings. I don't know to what extent other committees are doing it, to be honest with you. Because I've not checked in with other people about that, but and ones that definitely that come here and come to other committees that we can, this one is like painfully obvious about the lack of data coming from AOE. And that they're concerned about students not being identified. And we have lost resources in the state for all residents who are deaf or hard of hearing. So that I think it's an issue that we should bring up with our education counterparts. And I see Commerce isn't one of the people who was listed. But there's workforce issue there, and I'm sure that Representative Marcotte would take some testimony from folks about what we might be able to do to encourage people to go into that field. It's a pretty rewarding field. Yeah, but right now it's very tight. I mean, you have to give significant advance warning if you need an interpreter, and that's not always possible. Like, I know in my community, we have a couple of people who need an interpreter to come to town meeting. I haven't always been able to get an interpreter to come to town meeting, which is, you're not accessing your local government. Okay, so just as a summary, I will connect with both chairs about this report, and particularly with Chair Conlon, to see if they would be interested in a joint hearing next week about deaf and hard of hearing students and AOE's lack thereof response to their request. They may have some time next week. We'll see. So I'll check in with them, and then I'll also make Chair Marcotte aware of the need to take a look at interpreters.
It's interesting. We set up a commission, and then there should be a process for that commission to receive the data outside of a FOIA. And I don't know what that looks like, or maybe it's just a email to a chair. I don't know, but something to think about.
Yeah.
This doesn't seem appropriate that they had to go through that process.
And outside of employer too, I feel like if there was that relationship established and they could provide a little bit of context too alongside the data, especially if folks are working with that population.
Yeah.
But obviously, I don't know. Let me see what I can
Pretty extreme.
Okay. Thanks, Dan.
Oh, I have another one, which is just the Medicaid waiver money. So,
yeah, the choices for Karen.
what can I tell you? It's a list of numbers. It's pretty interesting to look at in terms of things that we fund through our waiver. There's also a lot probably under grants, because there are some pretty large line items that are just listed as grants. Imagine some of the things that falls under it is like the grant to Dale probably includes like Meals on Wheels, that type of stuff. They don't break it down. But there is a lot of interesting things that we're looking at as ways to reduce our use of Medicaid by being proactive, which is what basically that waiver does. It allows us to kind of try to get out in front of potential health issues that arise from try to be preventative. So anyways, it's a list of numbers. I don't know how you report on that, but look at it if you're interested.
In what's
And
going where, right?
as we, if we hear of any changes in our waiver, those are the things that are going to be either cut or discontinued. So something to look at.
Okay, thank you.
Thanks.
All right. Esme.
All righty, well, one of three. I'll start with the Community Violence Prevention Program. And this was super cool to learn about, and I think a really great model of how you take community partners that have their own special expertise and then empower them to really, collectively make a dent in, the level of violence we're seeing. So I think that's a really cool model and idea. And I this came out of a bill that I think judiciary, like I know judiciary had a heavy hand in, which turned into Act 23, 2 years ago. And, reading this, I, realized that this is an unusual circumstance where we were able to allocate $5 million for this awesome program. And so I think it will be really interesting to see what comes of that. And it's new, so we don't know yet, I think, the long-term results. But basically to give you an overview, so this, over 3 years, selected awardees can get access to grant money. And each year they cannot receive more than $150,000. And they're in this contract for either a 2 or 3 year period. And there was a rubric to decide which groups were successful in getting this grant, which is pretty significant. And we had 33 applicants to the program, and the report went into a good amount of detail about what the aims of each of those applicants were, which is cool to not have that information lost. And each had such, diverse areas of expertise, but recovery and community action agencies and restorative justice centers, family services, they all, I think, do play an integral role in community violence prevention. But anyway, after sifting through those 33 applications, 12 were selected based on the rubric that they decided. Those that were selected, the requirement now is to submit quarterly reports on how things are going and what they've been able to accomplish with what's provided. And then on our end, as a legislature, we've asked for an annual report. And in terms of measuring outcomes, like the impact of our investment here, this is where I kind of have some questions. We're looking to quite a few data sources. So like the YRBS, the Youth Risk Behavior Survey, law enforcement data, and the hospital and emergency department data. So those are pretty big pools to gather from, with programs that exist in very different corners of the state, with very different foci. So in terms of, measuring, I know these things are very multi-layered. So it is hard to measure impact, but I don't know. I feel like maybe the quarterly reports will have a better, give us more insight into what that impact is. Yeah.
Are you seeing any follow-up action required by the legislature or us in particular?
Well, I mean, the follow-up here is that, we've created this program in statute, of course, but the funding is not permanent. So that's just something to consider, that this is like a 3 year.
3 years? Okay.
Yeah, 3 year term of funding available, and that'll end in 2027. So it's our choice, I guess, depending on what comes of this, whether or not we want to, continue offering this grant opportunity to these or to different applicants in the coming years. But even though we won't continually provide funding, we are still asking for an annual report. So maybe, in 2027, we can reevaluate, if we do not fund this program, maybe we don't want to have a report, or maybe that would be dangerous to let it go into the ether. So, the model here, I think, is pretty cool, but it'll be interesting to, try to prove ourselves, what kind of impact this had.
Cool. And they list all the providers who got grants, and at this point in time, I think we're still, I guess I'd say, relatively new in terms of getting the money out there and stuff. So not expecting a report on outcomes yet, but I'm sure that all the grants have specific data that they're supposed to be reporting back. But yeah, I mean, I think the concept is a cool concept. Honestly, I'm surprised we found $5 million.
I know, that's what I was like.
Like, oh, why did we were talking during like the BAA and the budgeting, it kind of came up is like, we're putting this money in like prevention and these things and don't really ever have an opportunity to evaluate. So I like how this gives us, you know, multiple years, and multiple kind of program areas and areas of the state to really see like what's working, what's, you know, so we can better focus our investments further down the line.
Yeah, I mean, and I think it's informative to read all of the different grants that were provided and what each grant is aimed at doing, and like I said, it's all over the state, which is kind of cool. Which obviously was intentional. So it's good. The thing that I get concerned about is what do we do with the stuff that seems really good, but we don't have the money to continue.
Yeah. Well,
Yeah.
as a newbie, my concern is seeing all these other new bills made and stuff. I wonder if any of these places are double dipping and getting monies from other places now that they're being offered. I guess I would like to see if like one of these organizations are also getting grants from other places on top of all of this.
Well, they probably are because but not for the same activity, you know, so.
Right, but it'd be neat to see correspondence of where the money
That's how
goes.
these organizations,
Yeah.
like $150,000 is not gonna be able, an organization can't sustain it. So any one of those, they all do multiple things. And so they'll have like one or two staff that this grant funds to do this work. But then they'll have other grants.
Well, I know how it
Yeah.
works. But,
So it wouldn't be
but
double
these are
dipping.
like
It's
grants.
addressing different
And
needs in our
But
communities.
I like to
You're
see.
curious as to
breakdowns
see
of
what the
where
whole thing
sal-
is.
Who's getting paid, how much the salaries are, how much the insurance is, how much is actually going to the people.
Yeah.
That's what I like. I
Yeah.
like to see how the money's being used.
Yeah, that
You
might
won't
be
see, you won't
called,
see that in the
yeah, I was gonna say, that might be called micromanagement.
Not at all. It's a nonprofit. They have
Okay, just wait, one person talking at a time.
You don't realize these are nonprofits on.
No, I do, no, of course I do.
Responsibly.
No, I'm suggesting-
Answer to the people.
No, what I'm suggesting is that the legislature is not the body that would oversee.
Oh, no, I'd
this.
have to do it on my own.
Yeah.
I'd have to do it on my own, write to them, ask them for their 990 and.
Oh.
Yeah,
Yeah,
I've done it before.
yeah, no,
Yeah.
it is,
But I didn't have these specific names, so now I can go specifically.
Well, luckily you don't really have to look, this, they tell you exactly what they're doing with this specific.
Oh,
dollar.
no, I like the money breakdown.
This
this
is the
isn't-
money breakdown,
No, it isn't.
208,050.
Yeah, that doesn't tell you who's getting the salary, how much is going to benefits, see what I'm saying? If you were a bookkeeper, you would.
I was a bookkeeper.
Oh, you were?
Yeah.
So you.
So let's not make assumptions.
yeah, okay, folks. All right, let's like tone it down a little bit here, please. So, the kinds of, I just want to be clear, the kinds of things that, you know, one member is asking about are things that a board of directors would look at. It's not things that the legislature would see in that detail, just to be clear. So, so that's the end of that one. And we have Nolan here. And we're going to vote on H46. I asked Nolan to come because in the H46 has a very small obligation. The health department is good with H46. They've agreed. They think that they appreciate our sort of paring down of the expectations of the group. And so a fiscal note is not done until after a committee passes a bill. So, but I know that some members might have a question about that. So I invited Nolan, if you want to join us, Nolan. Because, you know, we always like to create work, but we just we thought like, okay, let's put some per diems in here so we can see Nolan. Let him come to committee. We like to see Nolan. So,
Any jokes first?
you have any jokes today? Yeah.
It's you.
Oh.
Yeah.
All right, for the record,
Yeah.
Nolan Langwell, jokester. So I already used one on you guys earlier. Let's see.
I have one I'd like to share.
Okay.
Okay.
How do celebrities and people of J,
Yeah.
how do celebrities stay cool?
With their fan.
They have many fans.
Fans, they have many fans.
All right, I'm gonna-
Say fans, but I don't.
Here's one more. It's a little risque.
Yeah.
But I think I'm gonna-
You're live.
What made the tomato blush?
Yeah.
It saw the salad dressing.
Oh.
All right, Laura, why do you gotta kill me? Why do you gotta kill my vibe? All right.
Zahn has one.
All right.
Well, it's just sort of, it came, I thought of it the other day during the devotional. There was a TV show I saw once where an adult was talking to kids about the golden rule and asking the kids, about it. And he pointed to one kid and he said, "So what is the golden rule?" And this little kid said, "Do one to others before they do one to you."
But do it first.
That is good.
Write that one down.
Yeah.
All right.
Why can't your hand be 12 inches long?
Then it'd be a foot.
Because that would be a
That'd
foot.
be
What,
All
right.
right.
Yeah.
I'm not saying any joke from lawyer around anymore.
You trying to out dad joke me? Come on.
I know, right?
Hey, when does a joke become a dad joke?
Oh.
When it becomes apparent.
Oh.
Got me on that.
Yeah.
All right.
Okay. All right. Business here.
All
It just gave me a look like, really? Okay, let's go.
I know, one too many. It's like having an extra. Anyway. All right, again, for the record, Nolan Langwell, the Joint Fiscal Office. I'm assuming the most recent version is 2.1.
Yes.
Okay, so I've looked at that. And in short, you have as many as 8 of the 11 members could be eligible for per diems. But it's only 4 meetings and it's pretty nominal. I think it's under, I did the math, it's under $5,000, for that. So, and then like things such as like, it says that they may conduct activities such as convening public meetings, maintaining websites. Again, those will be minimal costs that can be covered within the agency's budget, department's budget. So I don't think any appropriations are needed for this bill.
Okay, thank you. Anybody have any questions about that? All right, just wanted to make sure everybody understood before we got to the
Not
vote.
going appropriation.
No, that doesn't mean, but,
Probably will.
there'll be a fiscal note that says it's de minimis, just because we love that
I
word.
decided I'm not gonna use that word.
Oh, I love
I know. It's got so many other connotations. It just
Oh, okay,
would be very clear and to the point.
thank you. All righty, thank you, Nolan, appreciate it.
I'll get you t-shirts that's the minimum.
Okay.
Well, that's terrible. It's derogatory, yeah. Take that back.
Okay, so, just to, we should, go to today's date on our website, take a look, at H46. Just to summarize, this is going to create a rare disease advisory council. We have, talked about membership. So there's a list of members, and we have taken down the list of duties. You will see on page 3 that instead of shall, it says may conduct. That is something the health department wanted to make sure was changed. And things on page 4, these are the changes that y'all made the other day. Recommend to the existing screening advisory committee, new board screening advisory committee, any potential conditions, and then to support timely patient access to diagnostic and treatment services. Again, on line 12 of that same, the report as needed. The advisory council may submit any recommendations, doesn't say shall, it says may. And the council meeting shall be held quarterly or, and they can be held in person or remotely. And, then we just heard about compensation. So, this act shall take effect on July 1, 2026, and it says that because we have, this is not a crossover bill. It's a bill that will be considered by the Senate next year. So it will enjoy that nice little space in the Senate Rules Committee for the summer. And then it will probably come out next fall, next fall or beginning of the session next year. Anybody have any other questions or comments? Yeah.
So you did ask the health department and they're totally fine with
Yes,
this?
they're all good.
Because I know they were not with the first version.
Yeah, they're good.
And what are we hoping to, just for the public?
Yeah.
What are we hoping to get out of this bill and what would be the future, that would come from it?
Yeah, I mean, I think that the biggest thing that we heard from individuals with rare diseases themselves is a focus on working on the healthcare community, recognizing what their needs are, trying to provide information and support to other people with rare diseases. And, you know, we don't know about what the future identification of diseases are going to be, but we do know that, you know, at the current time, the federal support for people with rare diseases has just been
So
eliminated.
there would be no money associated in the future. Informational. and
This is
what
informational,
resources Are
yeah.
available.
Yeah.
No money.
Yeah, this is not guaranteeing anybody any money or any particular service.
Okay.
Yeah. Anybody else have any other questions? Okay, I would entertain a motion to approve version draft number 2.1 of H46.
So moved.
Okay, by Zahn. Any other question? Yeah, we don't have, I
That's right.
learned this, we don't need seconds. I didn't know.
I'm still writing it.
Well,
Come on.
Okay, the clerk, please call the roll.
Representative Bishop,
Yes.
Representative Cole,
Yes.
Representative Donahue. Say it one more time.
Yes.
Thank you.
Okay.
Representative Estes,
Yes.
Representative Garfano,
Yes.
Representative McGuire,
Yes.
Representative McGill,
Yes.
Representative Nielsen,
No.
Representative Noyes, yes. Representative Steady,
Yes.
and Representative Wood.
Yes.
10-1-0.
And Representative Garofano is going to be reporting this bill.
Excellent.
May I just note that I think I've become the person to report the bills that create advisory committees. This is my third one.
You volunteered. Can we create an advisory committee for Gray?
Yes.
We need the Ray Advisory Committee. Okay. So that, I think, we're moving the calendar on Monday. So that would be on notice on Monday. And so you would report it on Tuesday. Well, it'll go to appropriations.
It will,
Yeah. Because of the advisory committee.
Mhm.
They do.
A potential.
Yeah.
Yeah. Anything.
Okay. All right, back to reports.
Back to the list.
Yeah, so let's give Esme a break and we'll go to Zahn's report.
Okay, excuse me, I have to get it up here. One second. So, this is the substance abuse, substance misuse. I clicked it away, shouldn't have done that. It's funny trying to find, there it is. All right, so this one's, I found this curious in a certain way. It was called, because of Act 82 from 2019. So it's been in existence for a while. It's got, according to the statute, it has 4 items it needs to be reporting on, and it has a set of measurable goals that they've developed. And they then, so keeping in mind that it's been in existence for 5 years, they have 5 measures that they're using to reach the goals. The 3
I'm sorry, can you give me the name of the report again?
substance misuse prevention oversight and advisory council. It's an annual report. Did you find it?
I'm looking.
Yeah, it's down a ways.
Opioid above.
Yeah.
It's almost near the bottom.
Yeah.
Okay. Funny, yeah. They all blend together.
It's it's in a certain kind of alphabet type
Yeah.
designation, but not altogether. Yeah.
Oh,
There-
okay.
You see it?
I do.
Okay, so as you look at the top, you can see that it was called into being in 2019. So bear that in mind. This report, it tells what the report's going to include, and it doesn't really actually, that's what's required in the report. This report doesn't quite do exactly that, but it's close. Then it talks about 3 measurable goals. And then it has a set of performance measures, the first 3 of which there's a lot of data at the back of the report about. The second 2 are performance measures that they've apparently added in recent ones. So there's no reportage on any of they just talk about it kind of theoretically, about what they hope to be doing. So part of it is that it says at least annually that the council will meet with 4 other prevention lead organizations. And there's a way in which it doesn't quite talk about that. There's a lot of money involved with this. So I think it's important that we look at it annually and keep the report coming. But and they describe how the money is getting used in each of their programs that they're looking at. But there's no real, in my view, there's no real evaluation of whether the programs are working satisfactorily or whether the programs are successful doing what they do. They describe that, yes, we're doing this, but they don't, but there's no evaluation. And that's one of the report metrics that the 3rd report metric is evaluation of state funded programs. And there's in my view, there's no real evaluation. There is evaluation reports in the middle, some links, but they're all at least 5 years old. So it doesn't describe here for me to understand as a new person how often those evaluations need to be done. So maybe it's complete, maybe it's thorough enough. I don't have a way of telling that. So I think it's important to hear more. It's also interesting to look at the data report at the end. The data is mostly about youth and practices and uses of certain substances. And it's interesting, they're reporting pretty robustly on 2 years of report, both in COVID, 1 year after the other. So there isn't much change there. I don't have any way of evaluating when there are changes, whether they're significant changes. And that to me, again, in evaluation would help me understand a little more, which I just am not seeing here. So, not that we need to take
It's on the council.
I don't even know that.
How many times do they meet?
Well, they meet. What I read was they just met quarterly with the other groups. That was the intention, but I'm not sure that they actually did it. It doesn't say that. I don't find that.
It's interesting, as you said, that it seemed to outline some things, but not necessarily get to the substance. So I was curious, and I just pulled up last year's report by a similar report, and it seems like there's some repetition in the measurable goals for prevention programming and performance measures. So the language just seems to repeat.
Yeah, so it seems like I get the impression this is one of those we were talking about earlier when there are lots of voices involved, it's like, where does the responsibility really sit? And and I'm wondering if this one's sitting anywhere.
Well, yeah, I mean, this one is actually more clear. I mean, it's us and health and welfare.
Yeah.
I mean, appropriation is just there because there's money going.
Oh, I didn't mean about who should oversee. I'm talking about the fact it might be an.
Oh, so this was, so I was around, Dan was around for this one. There was,
2019.
yes, there was a lot of discussion. This is a Senate Health and Welfare creation. And this is something that Senator Lyons was very passionate about. And this is a bill where it was created, Monica Hutt's position, I can't remember what it's called, but Monica Hutt's position in the governor's office is
She's
really
on the
more
council.
into, yeah. Does it say who's chairing the council? Have you- could you look it up?
Mark, Dr. Levine. who-
Yeah.
So the Commissioner of Department of Health, and then there's representation from medical centers, DMH, the Chief Prevention Officer, they're the executive members, and then the council members are Director of Trauma and Prevention at the state, Department of Liquor and Lottery, Deerfield Valley Community Partnership, the Collaborative City of Burlington, appointed a member.
Yeah, let's see.
Yeah, just a lot, community members and Regional Treatment Court.
Well, it looks like, looking at their website very quickly, it looks like they do meet about every month or every 2 months, or that they did at some point, and I don't know whether they're just able to get up to speed or not. There are no minutes or anything for anything happening in 2025 so far, but that may be just having that time to get them uploaded.
So I think that this is one of those things that was it was at a time where a lot of different initiatives were taking place, and there was felt the need by some to have this sort of like overarching multidisciplinary approach to making sure that we're making the right investments kind of stuff, which is good enough goal. Whether or not it's doing that and fulfilling that role or not, I think is probably interesting. And we should probably take a look at the underlying statute that created this.
Okay.
And so if we're able to get some time with Katie, I don't know if we are, but because she's in high demand right now, it would be helpful. But I think that it would be helpful to understand what the council is actually doing now. So why don't we add Monica Hutt to, I always look for an excuse to have Monica come into the committee, because that's where her role was identified, even though it's sort of morphed into something different, I think. But so we'll add Monica to the list of people in the next couple of weeks, maybe, if we're able to get her to come in to talk about, and she will probably tell us it should be somebody else, but we're going to start with her. To talk about the council's annual report and how the council is functioning. Because it's
It may not,
yeah,
may
it's
not really be a thing, or may not need to be a thing.
I kind of wonder at this point in time, to be honest with you. And I'm not sure that what they are reporting on are the most relevant pieces of information for us to be looking at.
Well, it seems to me that if it strikes me that what struck me was that with as much money as being spent, I don't see an evaluation of whether that's being successful using the money.
That's part of the questions that we had last year in our budget and this year in our budget in terms of the prevention funds.
Exactly. Very similar to that. I felt like that was, I read the report.
Yeah. Todd had a question.
I asked my own question. I got it. Thank
Oh, you did? Okay.
I Googled it.
All right. Okay. Other thoughts about that? I mean, I think we should follow up on this. And this is one of those things like, okay, do we continue to need this?
Right.
Oversight and accountability.
And who did you say you're going to?
Monica Hutt.
Monica Hutt.
HUTT. Yeah, she's in the governor's office.
Okay,
Okay. Thank you.
thank you.
All right, we got time for one more. Back to you, Esme.
Okay, well, to end on a cheery note, the maternal mortality review. Yeah, really important, I think. Glad we're taking a look at this. This was established in 2011 and then updated a bit in 2020 in terms of what the mandate is. And the additional mandate that was added was to look more at health disparities and social determinants of health, which has turned out to be quite important based on the results. One of the most striking findings of this, I guess I'll establish first that they made their observations based on 11 years of data, which is a little bit more helpful than 1 or 2. And yeah, I think one of the most striking things was that it wasn't during childbirth that a lot of this, the maternal mortalities were occurring, but rather soon after. So between, either around the 45-day mark or up to like 130 days, I believe. So that was very interesting. Or between, before the end of the year after after giving birth.
So it's 3/4, like 72% of them.
Yeah.
Wow, have occurred in the postpartum period.
Yeah, so definitely interesting. And
Do they have one reason that stands out or?
yeah, they're so let's see. So polysubstance abuse or misuse was one reason. And let me see, I'm looking for the exact. So it says since 2012, nearly half of the 29 cases reviewed were directly caused by accidental overdose or endocarditis related to IV drug use. It says that since 2012, Vermont has averaged 2 to 3 perinatal deaths per year from any cause. So that's too bad. And let's see.
83% were low income poverty.
Absolutely.
Yeah.
So the fact that in 2020 we expanded the mandate to include like social determinants of health was huge. So yes, poverty disproportionately impacts Vermonters dying in the perinatal period. And that's they made that assumption based on those who had qualified for Medicaid or the WIC program.
Mm-hmm.
And that's maybe, I don't know, that doesn't account for those who may or may not have been insured as well. So that number, I think maybe even could be a little bit higher. Rurality also was actually a big key factor. And I think that correlates to mental health conditions as well, perhaps with isolation, but can't make assumptions there. But it says that more than 90% of perinatal deaths in Vermont occurred among people with a diagnosis of a mental health disorder or multiple diagnoses. And 10% of deaths were identified as being caused by suicide. So that's huge, obviously, support for folks in rural communities and, poverty is an indicator, unfortunately. So let's see.
Can I ask a question? There's reference on this as it starts to report the key findings, and the substance use one references nearly half of the 29 cases reviewed. Are we to interpret that during this 11-year period, did they just look at a sample, or is 29 total of the number of maternal deaths during that period?
It was the total.
Okay.
Yeah. And, in 2024, there were 2 more deaths. One of those deaths was human trafficking related. And so one of the recommendations was to provide, more comprehensive support, especially as a legislature, for that particular issue. Another recommendation, which I wholeheartedly agree with, is to, bolster our primary care providers, because it sounds like, both pre and postpartum, issues that were addressed in the ER could have been addressed in a PCP's office, especially those relating to substance use and treatment. So, I think access to those services would be really great prevention tool. And let's see, there's something.
You have a question, Jubilee?
More just a comment, kind of going back to the human trafficking. It's something we're seeing seeping into more and more of the conversations we have in here. It intersects with a lot of the things we're tasked to kind of oversee and protect. So I'm just wondering, they talk about the 2 case managers. They're great. I had a chance to connect with one. And I know they're really working on doing a lot of human trafficking awareness, but that might be, if we're looking to have folks come in, is perhaps invite them in to talk about what they're seeing. Because I do foresee that we should start thinking about what we can do as a legislature to start addressing this. It's a lot more pervasive and prevalent than we would like to think. And so I think it's just something we need to be really intentionally kind of incorporating into the conversations we have in this room.
Thanks, David. Couple of comments. So many of you might know, I was selected as a fellow for the NCSL's MCH fellowship, and last weekend was a kickoff meeting, and a lot of this is resonating. There are conversations that came up there during our workshop, especially around substance use. And one thing that I noted on my action plan, which, kind of lands in our committee, is can we use opioid settlement dollars to really impact this, given how prevalent, substance use is. That is a direct link to what those dollars are for, and prevention of deaths and helping support new families. So I'm hoping Rep. McGuire can bring this to the advisory council, the opioid settlement council, to figure out what organizations are in a position to provide statewide support to new moms. And then to your point around primary care, one thing that really came up at the summit this weekend was a lot of new moms barely go to primary care, they go to pediatricians.
Mm-hmm.
So that's where you want to kind of make sure that the pediatricians are trained and have the information of asking about, Mom, how are you doing?
Yeah.
Or the caregiver, how are you doing? How are you coping? And, doing screenings around mental health and substance use at the pediatrician's office. So that, I think, is a key
great
thing
recommendation.
to kind of think about, especially for families that are in poverty or have other challenges, that their focus is going to be on the baby in those first few months, not so much themselves.
Absolutely. Great. There's a couple other things I think to take away from this, and one is to say good job to us for advocating for empty arms. That was one of the recommendations.
Yeah.
And this, another is,
Which we did, and it's still there as far as I know.
there,
Yeah.
Another is, they made note of xylazine in particular and causing some of these deaths. And so I think as a legislature, just really paying attention to that. As something new, it says, this statistic was pretty striking. In Vermont, the rise in fatal opioid overdoses involving xylazine in Vermont rose in the general population from 5% in 2019 to 32% in 2022. That's huge stuff. So education around that is really important. And then the last recommendation I didn't want to miss here was their request that we sustain funding to the Office of the Chief Medical Examiner, so that, as we're seeing this you know, when folks do pass away, like being able to connect with the families, to get more context about the situation. It sounded like that was you know, they were struggling to find, the capacity to do that. And the pay that was offered there was too low, so that nurses wouldn't, and social workers had declined the job, basically. Yeah.
So are you recommending any particular follow-up? I think what Jubilee was talking about in terms of understanding on a broader basis, that I know seemed like it was just one case, on the human trafficking side of things, but we are hearing that more and more, in terms of it being an impact around substance use and a sort of cross-section of substance use and human trafficking. So I think that would be homelessness, yeah, an issue for us to think about how we, I don't know the names. I don't know the names of those.
I'll get you and
social
Lori that
Okay.
contact.
Okay, thank you.
Yeah.
Thank
And-
you.
Yeah. Oh, yeah. And I don't want to lose sight of Ray's comment either. I think
Yeah.
that connection, and I don't know how much control or say we have over, you know, education of pediatricians and, you know, maybe like presenting this as a report to specialists in that area that, you know, this is happening, especially during that time period.
I will say, as someone who is not so recently, but in the past few years been postpartum and all of that, the pediatricians, at least, you know, and I talk with them a lot about this because I'm also interested, they screen. So yeah, every appointment, there was a mental health screening that I did. They're screening for, food security, you know, they ask if you know, safety, and really, we're very skilled at, you know, making sure is and so I have conversations with this, because in the youth homelessness sphere, that's one of the things is like, you need to screen at as many doors as you can, because
Wherever
it may
they
not
are,
be the
yeah.
right one for them to disclose, but the more folks are asked, the more likely they'll find that right door. And so they said it is, you know, in their like pediatrician cohort world, it is something they really talk about and are trying, making happen more broadly. So, it'd be interesting to see
Yeah.
how far reaching that
Connect,
screening is happening.
Yeah. I can follow up with the health department as far
Yeah.
as like
Yeah.
And
education.
with the xylazine piece too, you know, we talk a lot about fentanyl, obviously for good reason, but I wonder, you know, I know of fentanyl test strips. I don't know if there's such a thing, xylazine or no. Okay.
No.
Yeah, so I don't know, like making sure that that's a really important part of the conversation where funding goes. with the opioid.
There's not test strips, but there are machines.
Yeah.
That,
Not
I remember testimony from last year.
Right.
We invested in a couple of them, yeah. But, yeah, all right. It's just so many things intersect, you
Absolutely.
know, so.
There are xylazine, they're new. The problem with them is they can't really give you an idea of how strong.
There are test strips.
Yeah,
Yeah.
whether it's present or not. And some folks actively seek out, like looking just because of the effects of xylazine that helps make it last longer. So it's,
Yeah, I knew that, yeah,
can almost, it's just a really scary
for 2 weeks. Sorry, we just,
situation.
if you're interested in this, there's reporting in Digger and Vermont Public about the judge ordering temporary restraining or temporary stay or restraining order on the Department for Children and Families regarding GA hotel motel folks. So it's an important read for our committee. So take a read at that. Okay.
Okay.
Alrighty, thank you. We'll pick up and finish up, hopefully, on this relatively soon, and appreciate everybody's attention. We are going to have one witness this afternoon, 2 witnesses this afternoon, sorry. Yep, all on the same subject, but,